Hi, I'm looking forward to seeing you for your microblading appointment and wanted to just go over a couple of quick things to prepare you so you get the best results and have the most amazing experience. First things first, 1 month prior to your appointment, you're going to want to make sure that you avoid any products on your skin, on your face, that have any retinol or contain any vitamin A. You're going to want to eliminate any Botox 2 weeks prior to your appointment. So make sure you get all your Botox injections at least 2 or more weeks prior to your microblading appointment. No facials at least 2 weeks prior to your appointment. You're going to stop those. So if you need to get a facial, make sure you do that at least 2 weeks ahead of time. No facials of any kind. If you're going to do your tanning or you're going to go outside and spend some time in the sun, give yourself at least 2 weeks before our appointment to get your tanning. You're going to want to avoid any sun exposure because that's going to impact your healing as well. You are going to want to start avoiding alcohol at least 48 hours prior to your appointment. So I would cut down at least a week prior to your appointment. So start cutting back a little bit a week before, and then no alcohol at all for the 2 days leading up to your appointment. The reason for that is it does thin your blood, it will increase your likelihood of bleeding, and it will increase your pain, which will also affect your healing in a negative way. You're going to want to avoid any blood thinning medications for at least a week in advance too. So things like over-the-counter medications such as aspirin. You're going to want to avoid fish oil, anything else that thins the blood unless medically necessary. If you do take blood thinners as prescribed by a doctor, even if they're over the counter on a daily basis, you do have to get medical consent from your medical professional to have the microblading procedure. So make sure that you have that. And if you do have any medical conditions that are pre-existing, or if you have had medical conditions in the past, such as cancer, autoimmune disease, things like that, you'll want to make sure that you get approval from your doctor prior to coming in for your procedure as well. And then you're going to also want to avoid caffeine for 24 hours prior to your appointment. And that isn't just coffee. So make sure you're not drinking any caffeinated sodas, caffeinated teas, or anything else that might contain caffeine, because again, that's going to affect the amount of pain that you feel. And it's also going to affect your healing results. So be sure that you follow all these instructions. We are going to go over them again. And keep in mind that we do reserve the right to cancel your appointment if you come in on the day of and you haven't followed these instructions. The reason for that is your safety is top priority to us, and we also want to make sure that you have the best results possible. If you have any questions, please feel free to shoot us a text, drop us a quick email, or give us a call, and we will see you soon. Thanks.